Polycystic ovarian disease, or PCOD or PCOS, is quite a common condition, can be found up to 5 to 10% of the population in women. And this condition is basically detected quite in young women because they usually present with irregular periods, and they can have 7-8 periods in a year. Along with, they can have acne and oily skin and facial hair, besides the losing hair around the forehead period. They're very classical pictures, but sometimes they also have some other metabolic abnormalities, which includes cholesterol and may have high risk of diabetes. But some women can present mainly with irregular periods. The main reason behind it is basically the follicles which rupture at 14 days does not rupture, and they have small follicles, and there is a hormonal imbalance with that. And that can lead to what we call as androgenic features, means higher male hormones compared to female hormone ratio. And because even females have little male hormones, and the ratio get altered, and that is the main reason they have certain symptoms, and that can lead to infertility and all the symptoms I described earlier. So the main way of diagnosis is to do some hormonal testing, clinical examination, and by ultrasound. And by confirming, the diagnosis after PCOD, because there could be some of the diagnosis which can mimic the similar symptoms, it's very important to understand that all women who have these symptoms may not have PCOD. So it's very important to look into that as well. And the main way of treating is because most women, it's like chicken and egg, they're overweight, or the overweight woman tends to have PCOD. So it's very important to treat a lifestyle disease as well and make sure you have weight loss if they are overweight or obese. The other way of treating is by treating metformin, because it has been found that they have little higher insulin level, and metformin tends to help and also stabilizes the hormone levels. The other hormones, medications which can give, is to suppress the male hormone levels. That can help with the hair growth, with excessive hair and the hair loss as well. And there are certain treatments like progesterone treatment, which are also one of the female hormones, which can also help with polycystic ovarian disease. One of the issues with polycystic ovarian disease is infertility. That is obviously needs to be dealt by treating polycystic ovarian disease and certain treatments which my gynecologist probably would talk about it. So in summary, PCOD is a very common disease. It can lead to abnormal periods besides the excessive hair on the face, hair loss on the foreheads, leads to some male-female hormones abnormality that needs to be dealt mainly by lifestyle disease and certain interventions from medications which can correct this PCOD. Sometimes very difficult to treat, and these women can have infertility issues as well. So thank you very much.